Good afternoon and welcome to Reopen Connecticut Arts Venues Science-Based Safety. I'm Eric Dillner, the CEO of the Shoreline Arts Alliance and the chair of this task force. The mission of our task force is to offer you the opportunity to reopen your arts venue from a public health perspective. Remain open with professional guidance in the workplace and in your artistic spaces. Provide a listening and sharing platform and help build consumer confidence through science. Our goal is to offer clarity, practical scientific advice, and the opportunity to ask questions related to your own risk reduction strategies. And I'm so thrilled that over this week, you've all sent us a lot of great questions. So today's going to be really, really fruitful for us all. Our plan is to help you dive deeper into your own process and help you to build strategies for consumer confidence and ensure the success and long-term viability of the arts sector as a whole. Together, we are reopening Connecticut arts venues with prudence and knowledge, and it's an exciting time for us all. To date, our webinars have reached over 12,000 viewers in over 18 states and 3 countries. And we're so thankful to the Emily Hall Tremaine Foundation, Connecticut Office of the Arts, Community Foundation of Greater New Haven, Connecticut Humanities, and the Community Foundation of Middlesex County for stepping up as partners, along with our biggest advocate, Yale School of Public Health. What a tremendous gift you all are giving us, the arts community. We encourage everyone to attend each of our webinars and to follow Shoreline Arts Alliance's YouTube channel and Facebook for additional information. You may also find many resources at www.shorelinearts.org. And I'm thrilled to announce that our website is now fully accessible. And you may also turn on your closed caption button. Well, you can turn it on or off anytime during the webinar. It should be down at the bottom of your screen for many of you. And of course, we want you to share this information broadly. So in a few days, it'll be up on our YouTube channel and you can pass this video along. So once again, let me introduce the fantastic Sten Vermund, the co-chair of this task force. Sten is the Dean of Yale School of Public Health, and he holds the Anna M.R. Lauder Chair in Public Health, as well as a secondary appointment in pediatrics in the Yale School of Medicine. As an infectious disease epidemiologist, Sten's research pivoted quickly to focus on the COVID-19 emergency, and he has led us and our partners nationwide to great success. Thank you once again, Sten. We also have with us today the most dedicated engineer to the arts, Krystal Pollitt. Krystal is an assistant professor in the Department of Environmental Health and Sciences and at Yale School of Public Health. And she also holds an appointment in the School of Engineering and Applied Science. We're so thrilled to have you both here. Thank you so much. It's been a crazy few months. We've been given a huge green light, and now we need to know what to do. We need to consider what the regulations have offered us and how and what decisions we should be making to keep our staff, artists, teachers, visitors, and patrons safe. And perhaps even more important and straight to the point, we want to keep them happy. Not only to come to your venue once, but to feel you're doing the right things so that they will return with their friends the next time. Sten, let's start by easing our stress a bit. Tell us how this vaccine is changing the opportunity for us to get back to the important work of bringing the arts to the community. And while you're at it, I'm wondering if you could retell a story that I heard you tell on our site visits this week, which was the simple facts about herd immunity. We've all heard it a bunch. It'd be great if you could just kind of outline that for us. And of course, why we need to encourage everyone to get vaccinated for art's sake. Sten?
I think everybody on the call knows that vaccines have been one of the greatest contributors to health in the 20th and 21st centuries. We used to have high death rates from everything from measles to diphtheria to smallpox and on and on. And we have mitigated all of those diseases with high vaccine rates. So come along the novel coronavirus, and happily, the science of coronavirus was very amenable to vaccine development. Not every infectious disease is like that. We don't have a vaccine for hepatitis C. We don't have a vaccine for HIV. We don't have a vaccine for gonorrhea. I mean, there are lots of diseases where we still haven't, developed a vaccine after 50 years of trying. But coronavirus was relatively simple. If you develop if you present an antigen, a little protein that stimulates an antibody response, that's good enough to protect you from the real disease if you're exposed to it later on. So we do have the definitive solution to the global coronavirus pandemic, which is high vaccine rates. That will be more efficient than all of the public health measures that we've talked about. We still want purity of air in our buildings. We still want good hand hygiene. We may have occasions to wear masks in flu season, but ultimately the vaccine is our solution. Now, we can talk about vaccine hesitancy later if you like, but this is a tremendous gift, and it's a transformative gift that our scientists and vaccine developers have made possible, and our politicians have decided to pay for it. So anybody can get a coronavirus vaccine for free through general funds rather than, and that helps address health inequities in our society if you can get the vaccine for free. Now, what we're really looking for is enough people who are vaccinated so that transmission dies out. And that will happen when an infected person coming into a room can't find anybody who's susceptible. So let's say we have an event, an arts event with 100 people, and we have somebody who is a symptomatic or asymptomatic carrier walks into the room. The probability of that person starting a transmission cycle, a transmission, network, is vanishingly low because the vast majority of people in that room are immune. And so there might be 3 other people who are susceptible, and the probability of this ball bumping into that ball, if you think of Brownian motion, is low, and therefore, even though the person was infectious, no transmission network was begun. And that's basically what herd immunity is all about, having enough people vaccinated so that the non-vaccinated people are also protected. You aren't starting the transmission chain the way we did a year ago at the birthday party, where somebody was infected and nobody was immune, and you had these super spreader events. So in the arts, this is very important, because if we have a 2-hour event, we don't need that event to be a super spreader phenomenon in our lobby, or standing in line for our concessions, or God forbid that we have transmission within our theater. We don't need that to happen. If a dance studio, we don't need one dancer to infect the other. And the museums, we don't need patrons to be infecting each other. So getting the overall rates high enough so that the COVID rates are low enough, we could theoretically get absolutely back to normal. So the Palace Theater could have normal seating and normal activity. Why? Because coronavirus rates are so low and vaccination rates are so high that it basically doesn't matter that 1 in 20 people in the theater isn't vaccinated, because you're still not going to have a risk of transmission. So that's really our societal goal. But we'll talk in a minute how we're going to operate in the interim, because by no means are all the people in Connecticut vaccinated, nor in Massachusetts, Rhode Island, New York, et cetera. We have quite a ways to go before we achieve that. But we do see coronavirus incidence rates dropping. The new case rates are dropping precipitously, and that's good news.
Well, this is all great news, Sten. Thank you so very much. And great segue. Frank, why don't we get you up here on the screen, Frank from the Palace Theater, and ask a few questions here.
Frank. We got to call on him next.
Yeah.
Come ahead.
Thanks, Sten. Thanks, everybody. And Sten, you had mentioned, the Palace Theater. I appreciate that. This has all been fantastic news. I mean, think about where we were a year ago, not having this conversation. So now we do see a light at the end of the tunnel. The vaccination seems to be working, infections going down, as you had mentioned. But as a business in the operation that we have, we are going to be at full capacity planning on it in October. How confident are you, given the vax rate as well as new variants of the virus, that we will in fact be able to pull the trigger and welcome over 2,000 people in this building, in the seats behind me, sitting side by side. How confident are you about that?
There are, let's say, 3 things in our favor. Number one is that Connecticut is number 1. We have the highest vaccination coverage rates of any state in the country. So there does not seem to be as large a pool of vaccine hesitant people in our state as, say, Wyoming or Texas. And that could work in our favor. Many of the people who haven't gotten vaccinated yet are wait and see folks. They didn't want to be in the first wave of vaccinees because they weren't so sure how safe this was, et cetera. And the more of their neighbors, the more of their relatives, the more of their friends who get vaccinated, the more likely they are to say, okay, I'm not anti-vax. I just didn't want to be first in line. And when we have 180 million Americans who've gotten vaccinated with at least 1 shot, you have this huge pool of safety data, and it's all very, very promising and exciting. So I think that a lot of people who have been waiting are going to get vaccinated. Now, we'll have the person who said, I didn't want to use a mask because it violated my individual liberties. I don't want to get vaccinated, violates my individual liberties. Or I think that Tony Fauci is in cahoots with George Soros and the vaccine companies to make a lot of money, and I'm not going to play their game. So you're going to have some conspiracy theorists, and you're going to have some libertarian ideologues, not an average libertarian who says, of course I want the vaccine, but there will be libertarians who, contrary personalities, who just because the government told me I should do it, I'm not going to do it. So is that going to settle out at 5% or 10% or 15%? We don't quite know yet, but those people are less frequent in surveys in Connecticut than they are in surveys in other states. Now, you could say people from Wyoming and Texas could come to the Palace Theater, and that's true, and they might not be vaccinated, and that's also possibly true. But we are going to be trying to socialize the unvaccinated, continue to wear masks, and we hope that there will be the ability to inspire people who are not vaccinated to do the right thing for their neighbors and friends. But since it's an honor system, and we don't have an app, the Chinese have an app, and you scan it, and then you can enter certain public places. We don't do that. And so in the absence of that, we're going to take some risk in our settings with unvaccinated persons. And I think what the lawyers are afraid of is they say, well, somebody's unvaccinated, they come into the Palace Theater, they get coronavirus, and they get sick from it, a week later, and they sue you because it's your fault. And it's hard to prove a negative, so you can't say that, well, they didn't get it in the Palace Theater. So it is going to require some language on every single ticket and on every single website. Again, I'm not an attorney, but I'm assuming that you're going to need a pretty big disclaimer that if you buy this ticket, the management is not responsible for any infectious disease that you think you might have acquired. And we'll have to get the attorneys to help us with that kind of language.
I appreciate that. Just as a quick follow-up, Eric, if you don't mind, we did a survey for some of our patrons. 92% of the respondents were very excited about returning in the fall. So that was good news, very optimistic.
Very good
for us. So we'd see the patronage coming back. The reality is, though, many of them had caveats. Meaning, are you going to require me to wear a mask? Are you not going to require me?
Yes.
What is the cleaning protocol? And they did want to talk, Krystal, you'll appreciate this. They wanted to talk about filters and air filtration. So what protocols do we need to continue to put into place for consumer confidence and get these people to come back and come back safely? And are these the same ones that we talked about a year ago or anything new?
We might want to think about various criteria for requiring mask use. And if the rate of COVID is above a certain threshold in the state, we might then ask people to wear masks. Even if it's not necessary for the vaccinated people, it would be something that would build consumer confidence and keep people confident that you're doing everything you can to protect them. But if the rates are below a certain level and the vaccinee rate is above a certain level, that may not be necessary, and it'll be a shame if some of our folks don't come back to the theater because of hyper paranoia and hyper concern, which is beyond what the science would indicate. People like Krystal and me are here to try to help you make some of those threshold decisions. And there are people like us who sit with the governor's office and are working with with DEEP, the environmental agency of the state government, and with DPH, Department of Public Health, to make some of these guidelines. And we're all trying to work together. Yale School of Public Health is working very close with the state government. So I'm going to guess that we're going to try to help you with certain criteria so that it doesn't have to be each and every venue making its own independent decisions, which would be a little bit chaotic and confusing for our clients.
Excellent.
But I'm going to defer to Krystal on what she recommends for air quality.
All right, we'll get there in just a minute. Why don't I turn it over to Darren for just a minute? Darren, you had a follow-up question there.
Sure. Should we continue the sort of the daily health checks and taking temperatures of people, creating a symptoms list, asking those travel questions? I mean, where are we at that right now?
I think it's very reasonable to ask unvaccinated people those questions, and I think it's overkill to ask vaccinated people those questions. So at Yale, when I came to work this morning, I had to fill out that thing. But as a member of the Public Health Committee, I'm going to ask that vaccinees in Yale not be required to fill that out because it's redundant, it's not necessary. You've done what you can to mitigate risk and reduce both your own susceptibility and your infectiousness to others. And that then puts it more in the category of all the other respiratory pathogens that we're up against. I mean, we don't do a daily health check for measles because we rely on vaccination to protect society for measles. Maybe we should do it in flu season for non-vaccinated people. And I think you're going to see a little more aggressive response to flu. Keep in mind that flu kills 10 to 50,000 people a year, all of them preventable if we would just all get our flu vaccine. So this is just a more extreme version of flu. This has killed 580,000 people instead of 50,000.
Great. Well, we just have a couple of vaccine questions that came in, and Judith McElhorn from Five Points Center for Visual Arts is going to ask those. Go ahead, Judith.
Hi, Sten. Hi, it's good to see everyone. So some of the questions we're getting asked are, why do vaccinated people need to wear masks if they're personally protected and they can't spread the disease?
They don't need to wear a mask.
Excellent.
However, I am sensitive to perception.
Mhm.
And if I'm going into a group setting and nobody knows me and nobody knows my vaccination status, I feel very comfortable putting my mask on because I just want my neighbors and my fellow travelers to feel comfortable. So I'm going to derive little to no benefit, and they're not going to derive much benefit from my masking. But that's why Metro North is still requiring it, because there is no way to distinguish the vaccinated from the unvaccinated. And I think that when I'm going shopping, when I'm entering a restaurant, when I'm doing basic things with people I don't know, I think I'll probably mask. And if it's a small group of 6, 7 people, we may say, is there anyone who isn't vaccinated? If so, we're happy to keep our masks on. But if we're all vaccinated, oh, you're all vaccinated. Okay, off go the masks. And, if 6 out of 7 people were vaccinated, maybe we'd leave the mask on just to have that unvaccinated person feel more comfortable. So I'm going to be playing the socially responsible card and not sticking with my infectious disease epidemiology skill set but moving more to a popular courtesy skill set. And that's when I'm going to be wearing a mask when I don't need one.
Thank you.
I'm speaking very personally now.
Yeah, well, that's very helpful. Thank you so much.
Great. Okay, thank you, Sten and Judith. Krystal, let's talk a little bit about air handling. Through the pandemic, we have learned how very important our building's air handling system is. Do we still need to think about air in our buildings, or can we just go right back to as if the pandemic never happened? What are your thoughts, Krystal?
So first off, I was really pleased when Frank mentioned that people are still asking about on HVAC, on filters, because what the pandemic has done in terms of indoor air quality, it started to have us think about it across a much wider scale than we previously had. And this is an issue that is not going to go away in the very broad sense of indoor air quality. It's something that we need to continue thinking about, but at least we'll be able to shift our viewpoint from not just thinking about SARS-CoV-2 in the air, but all the other sources of air pollution, all the other airborne pathogens, especially during flu season, that by shifting our focus back to HVAC and filters and air quality, then we'll also be able to mitigate a lot of those cases and illness.
Great, thank you so much. That's what we all thought. Thanks. John Carl from Connecticut Nonprofit Alliance. You have a follow-up question there?
Yeah. Hi, Krystal. Thank you. What about beyond COVID? Can we improve productivity and health beyond COVID by paying more attention to our air handling systems as we return to the buildings that we work in?
So just as I mentioned, that by being attentive to the air quality in our spaces, the ventilation, the airflow, making sure we have sufficient air changes, all these topics that we've talked about in past webinars, is all going to benefit from keeping occupants of the spaces healthier. You mentioned about productivity. There has been chemicals in the air that have been linked to, if they're lower levels, enhanced productivity and different cognitive outcomes. So there's a lot of benefits overall to maintaining good indoor air quality.
So does that mean we're all gonna get sick a little less if we really pay attention to it, Krystal?
I think there's a lot of factors that are going on in indoor spaces that are going to contribute to our overall well-being, but indoor air quality is one of those factors.
Yeah, absolutely. Krystal, I was on another call recently where the discussion was we're really heading into a health age, I think, where we're all going to think about this an awful lot. And there was talk about when we're building new buildings, maybe we need somebody like you there by the side of the architect, really helping them think about the health of the space. Is that something you're hearing elsewhere? Or is that something you believe in?
Yes, exactly. So I'm so excited about the new collaborations, the strengthened collaborations that are forming between public health and architecture. And Sten and I are really excited to be leading some of those efforts right here at Yale. Excellent,
wonderful. Yeah, well, so we in the arts community are always thinking, what's next? And if with gathering so many people, I think it's going to be in our best interest also to be a part of that team as we move forward. So thank you so much for all that help. Let's talk a little bit more about audience and patrons. Let's really get a little closer to the consumer confidence question. Darren, do you want to lead off the questions here? I think you're on mute.
Sorry, I'm on mute. So, when we're dealing with consumer confidence, and part of this I think you may have addressed a little bit, but where on the front line where we come in contact with such a diverse population and diverse opinions, so how does an arts business accommodate the varied mindsets of all those patrons? And how do we give us the best sort of advice to handle different situations?
I think I speak for all of us in saying that it's our obligation to tell our patrons what we're doing on their behalf. And I think most of you have done a superb job when I went to New Haven Symphony Orchestra event. It was an outdoor event, and announcements were made, and it was made crystal clear to us what was being done to reduce risk, and it was very reassuring. And so I feel like maximum communication, it can be from the podium, or from the stage, or it can be on the website, or it can be from all the above, and I think we need to tell people what we're doing and why we're doing it, because we are blessed with a fairly high education clientele for most of the arts. And there's no reason why they can't understand our arguments for what we're doing and what we're not doing and why we're not doing something again. So for example, let's say that we have a summer event outdoors and coronavirus rates are very low and vaccine rates are climbing. We could be talking about 3-foot distancing rather than 6-foot distancing. And we could explain why we're permitting 3-foot distancing and point out that the governor approves this. So there are all sorts of ways of I think, reestablishing consumer confidence by being very frank and open with them about exactly what we're doing and why, and what we're not doing and why.
Let's see. So do we have a follow-up question there?
Yeah,
We do,
I'm
from
gonna,
Frank?
yeah, I'm going to jump in, and I'm going to take it from the perspective of I have part-time staff and volunteers who are going to be dealing with the general public. And you know that everyone, and based on the survey we've just received, everyone's perception is a little bit different. Everyone's comfort level is a little bit different. This is a hard question maybe, but I'm going to have to ask, what tools do we give our staff to deal with those individuals who, number one, might be nervous about being in the environment because of whatever, they see someone without a mask and they're concerned? Or what about, how do they deal with the patron who is not supportive of the idea of any policies we have because they don't believe that in fact there is an issue or that we're taking it to the extreme? Customer service is going to be a huge part of that. And we're going to have to be on both sides of the fence because we're going to have to answer both questions to both concerned patrons. I mean, tips, advice from anybody on how we're going to manage that? Did I stump you?
Yeah, you're on mute, Sten.
There's so much incoming on the Q&A and on the chat, I can't even. So I got distracted answering, and I basically didn't hear your question.
Oh, great.
I'm going to stop. I'm going to stop doing Q&A and chat. I'm going to leave that up to Eric to
Yeah,
monitor
actually,
that.
Sten, I just did the exact same thing. I got caught over there. People keep sending in the questions. We actually have many of your questions about to be answered anyway by several.
Okay, Frank, do the short version of your
so
question.
don't worry about it, Sten.
Short version, we have staff who's going to be confronted with patrons on both sides of the fence, some who are nervous to be in the environment, some who don't believe that there's actually an issue. What tools can I give staff members to allay concern and or dissuade people from being angry that they're required to do things that they
the
want?
number one concern that you can allay with staff is that when we have 95% effective vaccines, they're hugely safe. They're 99% effective at preventing hospitalization. And they're 99.9% plus in preventing death. So that the staff, the volunteers who are vaccinated can feel very comfortable going about their business. And it kind of doesn't matter what the vaccine status of the patron is from their own personal protective point of view. Now, it's a different story when we seat our auditorium and you've got a cluster of unvaccinated people and they could infect each other. So, that's a different issue. But from the point of view of staff and volunteers, if they agree to be vaccinated, they have done what they need to do to protect themselves. And it's not necessary for them to wear masks. And if they're going to wear a mask, it would probably be on the Metro North, where it's a different kind of setting. But if you say our staff and volunteers are not wearing masks today because 100% of them are vaccinated, and we ask all unvaccinated patrons or guests today to keep their masks on for the duration and try to maintain physical distance, then I think that would be the best we can manage.
Krystal, maybe you could weigh in on this a little bit as well. We were on a couple of site visits this week, and two of them actually sent me a note afterwards thanking them for your DIY filter idea. And one of the reasons that they said that is that they got it that they were going to be safe in their environment, but they felt that that was actually going to add to the consumer confidence level, having people knowing that you're still addressing the air handling. What are your thoughts on that? Are we doing that right? Using that as a good piece?
Yeah, that's an excellent piece. And there's a lot to be said for these visuals, just like wearing the mask, even for the vaccinated patron, to be able to show that there is something being done, that the venue is being attentive to the existing public health concerns. So the DIY box fan idea is a great way to do that. It's also going to have its benefits moving forward, especially during flu season. The other device that I had mentioned previously is investing in a carbon dioxide monitor. And that has a visual display on with a number value for the concentration of carbon dioxide within the space. And that can be used as a proxy for the amount of ventilation. And even having some sort of color coding to say, green, this is a concentration that is good, and this is a high level concentration. And look, we're in this green area. That tells us that we have a good amount of ventilation in our space.
Oh, what a great idea. Excellent. Thank you. That's super. John Carl, I think, do you want to drill down a little bit further with this vaccine question?
Yeah, really, I want to ask about people who may be immunocompromised or those who just can't get a vaccination. How do we make environments safe for them, and how can we be fair to them?
The folks who need vaccination most are the ones who are immunocompromised. They desperately need vaccination, and every one of their doctors is going to urge them to get it. The question there is whether they will respond as vigorously with a compromised immune system. Will they truly be protected with the vaccine? And there are ways that we can check. We can check with antibody levels and the like. So I think that doctors are going to work with their patients who are immunosuppressed to urge them to get vaccinated. And then they may do something they don't bother doing with the rest of us. The rest of us don't get a routine antibody test afterwards to see if we seroconverted, because it's not necessary, and waste of money. But and by the way, we're talking about people who are fairly profoundly immunosuppressed. Lots of people have mild immunosuppression from a whole host of diseases, respond beautifully to the vaccine. So I think that's probably the way that's going to be handled.
Very helpful. Thank you. Thank you so much, Sten. Judy Dworin from the Judy Dworin Performance Project has some tough questions for you, Sten.
Yeah. Can we, in fact, legally require someone to be vaccinated? So that I know that colleges are requiring students to be vaccinated before they return. How does this affect the arts?
So I'm neither an attorney nor do I play one on TV. So with that caveat, it's my understanding that private organizations can limit clientele based on behavior or certain characteristics, as long as it doesn't violate federal, state, or local discrimination laws. So to exclude someone based on religion or race or something from that would be illegal. But to exclude someone who is a chain smoker who refuses to give up their cigarette walking through the door is legal. So you can see my analogy is that agreement to get a COVID vaccine is more analogous to somebody who agrees to snuff out their cigarette before they come in and agree not to smoke in the theater. So when it comes to health issues, reasonable requests are generally held up by the courts. For example, required vaccinations for school children, required vaccinations for hospital workers, required vaccinations for people in the military, for certain types of care providers, teachers. So there are all sorts of vaccine requirements in our society that are perfectly legal, and they are something that you could consider in your work environment. Let's say you're running a dance studio, and you have volunteers who come in and dance. If someone is not vaccinated, I believe that it's your right to exclude them from the dance studio. I don't think you have to accept them in your dance troupe, because that is analogous to somebody who's smoking while they're dancing. You're gonna potentially do harm to others. So I feel like it's likely that we can do that. And that would be very easy on consumer confidence. Everybody who buys a ticket to Palace Theater has to tick box that they have been vaccinated. Otherwise, we would ask you to defer your return to the Palace Theater until which time you are vaccinated. And maybe you could have 100% of your clients be vaccinated. But then how many people are you going to piss off? And how many long-term resentments are you going to start up? And what kind of battle are you going to have even among your vaccinated clients? Say, well, I don't think that's fair that you exclude non-vaccinated people. I mean, there's a potential price to be paid, a societal price, with people who are not sympathetic to your point of view. Now, Yale University required all students to be vaccinated to re-enter school in the fall, and they decided that a month ago. And then they debated and talked to the unions and talked to the experts and agonized for a month. And last week, President Peter Salovey at Yale announced that all faculty and all staff must be vaccinated. So that's a private university deciding the balance between personal liberty and social responsibility. And there's always a tension between those 2 points of view.
Right.
Social responsibility, motorcycle helmets are required for everybody. Individual liberty, it's up to you to choose whether you wear a motorcycle helmet or not. So different states have different balances on individual liberties and health and preventive health. So there is no one size that fits all, but that's what Yale's doing. And there's not a giant upswell of opposition here at Yale to that. Most people I've talked to say, great, I want Yale to be a COVID-free workplace, and I want Yale to be doing everything it can to keep Greater New Haven safe. So for those two reasons, let's all get vaccinated.
Okay. Okay. So here's another hard question. How do we ensure that people follow the guidelines that we put in place, so that even if they are vaccinated, whatever guidelines we put in place, how can we be sure that they in fact do them?
Same way we are now. We have to do some degree of policing. If somebody's too close in the museum and they're not part of the same group, I saw at the Metropolitan Museum of Art a month ago that the guard came over and reminded them gently to physically separate. So I think that's the sort of thing that we would still do. But I would remind you that with vaccinated individuals, we really don't care what they do. They can be physically proximate, they can be unmasked. Their risk to others and to themselves is absolutely minimal. So we don't want to be unreasonable in what we request. For example, let's say you're running a dance studio and your students and your instructors are all vaccinated. It's back to choreography a la 1995. It's back to Pilabolus, you know? So I feel like you wouldn't want to be unreasonably asking people to do things that are not necessary. But if you have an enterprise where you know that you will have unvaccinated people, then you might be asking people to do things that wouldn't be absolutely necessary. But if you want to be homogeneous in your sort of request for the audience, then maybe everybody would wear a mask, even though 90% of them are vaccinated and don't need to wear a mask. That's going to be decisions that you all are going to have to make. And then if, by the way, if the background rates are very low in society, in Connecticut, and there's very little virus circulating, then you could liberalize your mask use. And even if 10% of people were unvaccinated, you wouldn't require masks. that would be a perfectly reasonable thing to do. That's what I was alluding to earlier, trying to get some help from Liz Shapiro and people in the state. Let's try to set up some guidelines that can help all of us with these sorts of decisions.
Thank you so much, Sten. And thank you, Judy, for asking the tough ones. We still are probably faced with the challenge of not knowing proof whether people are vaccinated or not. But you've given us many reasons why we can mix even if everyone isn't completely. So thank you, Sten, for that. We're going to ask, actually, I'm going to go back to Frank at the Palace Theater to talk a little bit about cleaning, if you would. You've got a couple of questions coming your way that way.
Sure. Thanks, Eric. I mean, again, this conversation is so different from the conversation we had a year ago, right? So there's actually hope and optimism. And as I recall back in the day, in the early onset of this, we were talking about extensive cleaning, about using the right type of cleaners, wiping down surfaces because of contact tracing and the spread of disease. Has this significantly changed again? Do we know more now than we did a year ago? And how much cleaning is required? Does something need to be wiped down in between every usage? Where can we truly operationalize our cleaning protocols now in this new environment? And what has changed over the last since we've started this conversation a year ago? I'm not repeating myself either, Sten. So
I sort of thought that one was for my esteemed colleague, Krystal.
Krystal, would you like that one?
Sure, yeah, I can answer that one. So just as we discussed before, so that there's still a lot of benefits to maintaining good hand hygiene, and the same with surfaces as well. So keeping them clean. The same level of attentiveness, I don't think is required, and we're really being cautious about the amount of like chemical cleaning products that we're using in our spaces, because some of those will contain some compounds that we want to be cautious about excessive exposure to. And we just also, to go along that point, is that we know that the fomite roots and the surfaces are not as prevalent and dominant of a route of transmission. So the excessive cleaning by no means is needed going forward.
Which is great news from an operational perspective, from a financial perspective, because as we were going to be implementing new policies or welcoming patrons back in, the idea that everyone had to have their own individual cleaner following behind them to wipe up. It's good to know that that will not need to be implemented, and we can go back to pre-COVID cleanliness. Cleanliness is important, but pre-COVID standards are fine. Is that what you're saying?
Exactly.
Wonderful. Okay, great. Thank you. There are a lot of questions in the Q&A asking about that. So thanks for addressing that from so many different sides. And John Carl, another one that's being asked a lot throughout our Q&A. Maybe you can address that.
Yeah, it's a real question as we get back to normal. Is it safe basically to eat and drink together again, whether it be outside or inside? And if you're in the office and you share a communal coffee pot, is that okay? Are we back to normal on all of those things?
We are, if we are vaccinated. Really easy answer.
Mm-hmm.
And if there's a subset of people who are unvaccinated, they can acquire the vaccine. They can acquire the virus. They can transmit it to other unvaccinated people. It's a shame if we can't get at least our own staff and our own volunteers fully vaccinated. There is the safest and most effective vaccine ever developed in the history of humankind that is sitting there as a tool for getting us out of this bind. And I could say that there are two groups of people, maybe three groups of people, who need to have a passion for this. One are healthcare workers. Hello. Number two are people in the arts, music, museums, dance. Hello. And then third, I would say in the education field. And anybody who deals with groups of people where super spreader events can be the norm, in a theater or in a dance studio or in a museum, a hospital setting where we're going to fill our beds with COVID or we're going to use them for other purposes. Or we're going to overwhelm our hospitals as we did before. And then what about army barracks and schools? And I mean, any prisons, any institutionalized setting where large numbers of people congregate, we need to vaccinate. And I suppose if you've got the hermit on the Wyoming ranch who doesn't particularly care to vaccinate, little harm will be done. But the rest of us live in a social society, particularly in the Northeast, where we have population densities which are substantial. So I think the rule of the day is that we all need to at least create vaccinated microcosms, as Yale is trying to do.
Thank
At
you.
least.
Absolutely. Sten, so we have a lot of questions that are coming in about performances. And I think you really addressed a lot of these questions in a general manner, but let's just talk about artists and their safety. You gave some really good points when we were down in Westville Music Center. I'm messing that name up, but when we were down in New Haven in the old tennis facility, you really helped them look at, it's an outdoor facility. It's got a lot of touring musicians. They do have indoor facilities for the artists. Can you just walk us through what we should be thinking about in the artist as artist communities that shift around through various communities?
I certainly can't speak for an artistic director running a theater or a music mogul, or but if I had my druthers, I would like my performers to all be vaccinated. That just simplifies my life tremendously, and it also reduces my liability tremendously. So I think that if I want the hottest rock group and they don't want to get vaccinated, I've got economic pressure to bring the hottest rock group to town and put them on, but I've just increased the complexity of dealing with those people up 3 notches. I mean, I better be absolutely sure that we've got them in a bubble, that we don't have a lot of outreach, we don't have a lot of mixing. Usually you don't manage your performers that aggressively, but I think I would be especially aggressive at keeping people apart, keeping that band as a pod, like a family pod, and knowing that a bunch of them are unvaccinated, trying to sweep them into the facility, do their concert, and sweep them out with as little dead time in the facility as possible. And as I wouldn't want them sitting and signing CDs with a stream of people who are bending over to talk to them. I mean, I just, and then if I did have something like that, I'd want some physical distancing and 6 foot. It's very complicated. So I'd much rather have them vaccinated so I could simplify my management challenges.
Excellent, thank you. That's really helpful. Sten, we have an interesting question here that is, should we be expecting middle and high school audiences to return on field trips in the fall? I know you and Krystal have been working so much in the school systems to help them stay open and all that. What are you hearing? Or do you think our arts groups are going to have the benefit of sharing the art with a bunch of kids coming up in the next year or not?
I think the 12 and ups, yes. I think the 11 and below, it's going to have to wait a couple months, because we're not going to finish the children's vaccine trials probably until July. And then you're going to have to give the FDA a few weeks for review of the safety and efficacy data. And then you're going to have to let our pediatricians and our school nurses get all these kids vaccinated. So they may not get fully vaccinated until, I'm just making this up, Thanksgiving. But I think we can easily vaccinate our teenagers over the summer. We no longer have a vaccine shortage. So it's just a logistics challenge of getting parents and kids coaxed into coming for their vaccines. And we've had a big surge of vaccines here at Yale. We've identified all of the teenagers who are in the Yale Health group that are employee children and sometimes student children, and they're getting vaccinated with alacrity. So I think that we're hoping that our upper schools and our high schools are going to return pretty much to normal in the fall.
Darren has a question for you from the Q&A.
Sure, and it's sort of a follow-up from what you were just saying, but you know, we're getting ready to do our summer season outdoors, and the rules and everything are changing. Now, normally for the summer, we attract a fair number of family audiences. Now, even though the majority of my audience is most likely going to be fully vaccinated, I can't guarantee if they're not going to bring under 12. So would you still recommend the proper social distancing, you know, just in terms of everyone, because we have no way of knowing what the age of someone is coming or something along those lines. So if you could just address that a little bit, that'd be very helpful.
Well, I'd love to hear Krystal's view on this, but the way I've thought about it is that we have better evidence that the 6-foot distancing was perhaps not necessary, that we do pretty well with somewhat closer distancing when we're dealing with masks. And we have a big school study from Massachusetts, for example, suggesting that in the masked environment, the 3 to 6 foot distancing did just as well as the 6 foot and more. So masks may work better than we think. But if some of it's going to be the logistics and the audience you have. So if you can have a little bit broader distancing without compromising the integrity of your financing and meeting, you know, consumer demand, why not have it a little more distanced? But if you have to do family groups and then family group nearby, and those family groups are not separated by quite the magnitude of distance that we did previously, I think that would be reasonable. We've got low coronavirus rates now, and I think we can look to the Department of Public Health governor's guidelines and just follow them and just take that out of our equation. Just see what the Department of Public Health is recommending and just follow their guidelines. That way you don't have to explain anything to anybody. You don't have to make your own decisions venue by venue, and you can rely on the DPH and their assistance from the Yale School of Public Health to make some of those decisions for you.
Krystal, do you want to weigh in on that?
No, I don't have anything else to add.
Okay. So Sten, we have another question that just came up, but let's ask a quick question about a large theater producing a production of SpongeBob SquarePants the musical. You know, the place is going to be filled with kids. So I think what you just said is right in line. But is there anything to add when we're really targeting a young audience?
I'd ask for the audience to be masked. All the kids are used to it. They're in school masked, and I think you know, if we can manage 3 foot distancing with masked kids, we're doing just as well as we're doing in the schools.
Great. Frank Trevera?
Quick question on testing. Okay, so we've been vaccinated. Some of us have been vaccinated. We're in contact with someone who might have COVID, might be symptomatic or asymptomatic. As a vaxxed individual, are we required to get retested, or is it a crapshoot at this point?
Testing is a big waste of time and money if you're vaccinated, unless you have COVID symptoms.
Okay. Love the answer.
Yeah, so that's actually a question that we were hammered with this week, and we wish we could answer. And Sten, we were at the Goodspeed Opera House this weekend on the site visit. A similar question about equity. You know, the actors' equity and their rules. And there we go. He's got his Goodspeed hat on. You'll see him in a second here. Keep that on. They didn't see you do that, Sten. we learned a lot about actors equity, and we'd really love to have a conversation a little bit further there, because I think there is some restriction. Many of these outdoor facilities this summer who have equity performances, one person quoted it's going to cost them $14,000 for the testing, even though they know everybody's vaccinated. So
Waste of money, waste of money. Everybody will tell you it's a waste of money.
Okay, show them your hat now, Sten.
I did.
Well, we all missed it, unfortunately.
You all missed it.
We all missed it. There we go. There, he's got his hat on.
There I am.
Okay, so we're just nearing the end of our time. You know, it's so funny because we have just a gajillion questions that came in. We know that we so hope that we're helping you all get a lot of these answered. We'll continue to collect questions. We have another webinar actually scheduled pretty soon, in just a couple of weeks. So we'll try to cultivate all these questions out and get them back to you. But if you have anything that you need to know in the next day or two, just email me directly, and I'll see if I can get Krystal and Sten to give us a quick answer. But boy, the two of you really gave us so much to think about, and so many things. Sten, Krystal, is there anything that we should be that we haven't covered today, that in all of your work, that you think we should be thinking about?
Krystal does have a list of CO2 meters that she's researched. So if you need that list, she's happy to help.
Okay, if you could send that to me, Krystal, then I'll get that out to everybody. That would be great. I also want us to think about, in our coming months, about what we've learned, Sten and Krystal. What have we learned from this pandemic? Like, how do we prepare for, should there be another pandemic? Should we be thinking ahead as an arts community? What should we want to leave on a positive note today. Things are great, but let's just be a little bit more prepared for the future together. Again, I want to thank everybody for being here today. Thank you for all your amazing work. We hope to get out to some more venues soon. And unless there's anything more, I think we'll say goodbye. Have a great day. Take care. Enjoy the beautiful weather. Bye-bye.